I'm Vi.
And I'm Janica.
We're second year medical science students, and today we'll be presenting a clinical case involving a clavicle fracture sustained during basketball.
We'll discuss first aid, clavicle anatomy, histology, embryology, and the bone healing process, integrating clinical relevance and medical imaging.
When Mark fell on his outstretched hand and suspected a clavicle fracture, the first priority was to keep him safe and calm. I supported his left arm using an improvised triangular swing made from a t-shirt to limit shoulder movement and reduce pain. I also checked for possible neurovascular compromise by assessing finger sensation, radial pulse, and skin color. Since the clavicle sits above the subclavian vessels and brachial plexus, which can be injured in these fractures. Immobilizing the arm until the ambulance arrived helped prevent any further displacement and protected these underlying structures.
The clavicle is an S-shaped long bone connecting the upper limb to the trunk. It has two main parts, the medial 2/3, which is convex anteriorly and attaches to the sternum, and the lateral 1/3, which is concave anteriorly and articulates with the scapula. It forms two key joints, the sternoclavicular joint, a stable saddle synovial joint between the clavicle and the manubrium, acromioclavicular joint, a plain synovial joint connecting the clavicle and the acromion. Ligaments like the costoclavicular and the coracoclavicular provide stability, but the middle third has less ligament support, explaining why fractures here are most common, around 80%. Functionally, the clavicle acts as a strut, holding the shoulders laterally, transmitting forces from the arm to the trunk, and protecting important structures underneath.
Histologically, the clavicle has a thin outer layer of compact bone and an inner core of spongy bone, allowing strength without excess weight. Within compact bone, concentric layers called lamella form osteons, which surround Hervatian canals carrying blood vessels and nerves. The key bone cells are osteoblasts, which build bone by secreting osteoid, osteocytes, mature cells maintaining bone tissue, and osteoclasts, which remodel and reabsorb bone when needed. Its rich vascularization and cellular activity explain why bone repairs itself effectively after a fracture.
Clavicle is unique in its development. It's the first bone to ossify during gestation, beginning around the 5th week. It forms through dual ossification processes, such as intramembranous ossification in the middle portion, where the bone develops directly from the mesenchyme, endochondral ossification at the lateral ends, where the bone replaces cartilage templates. The ossification centers fuse fully around the age of 20 to 25, which explains why clavicle fractures are more common in children and adolescents due to incomplete fusion.
Mark's clavicle fractured after a fall on his outstretched hand. This mechanism, known as FUSH, transmits force up the forearm into the clavicle, causing midshaft fractures. Nearby structures are very vulnerable. The subclavian artery, the subclavian vein, and brachial plexus all pass beneath the clavicle and can be damaged during severe injuries.
Following a fracture, bone healing occurs in 4 overlapping stages. The first phase is the inflammatory phase, which starts from 0 to 7 days. Blood vessels rupture, forming a hematoma. Immune cells release cytokines to recruit repair cells.
The next phase is soft callus phase, from 1 to 3 weeks. Fibroblasts and chondroblasts create a fibrocartilaginous callus to stabilize the fracture.
The next and third stage is the hard callus phase, which is from 3 to 8 weeks. Osteoblasts replace cartilage with woven bone, regaining strength.
The last stage is the remodeling phase, when woven bone becomes organized lamellar bone, restoring normal structure and strength.
This process is driven by osteoblast and osteoclast activity and supported by the clavicle's rich blood supply.
In summary, we discussed immediate management of clavicle fractures and explored the clavicle's anatomy, histology, and development.
We also explained the stages of fracture healing and how bone structure and blood supply contribute to effective recovery. Thank you.